Okay, well, this is me. I want to talk about my experience. Nowadays, more than 1,700 patients treated. I came from the other part of the world, 24 hours by plane. It's a lot. Well, I invited to meet my country. Well, I started right now. Over here, yeah, this is over here, my conflict of interest. I really believe in the phrase, we all have the right to repent, like transform us. Tattoo no longer have to last forever. Our marriage don't have to last forever. We need to handle with that, or we can fix it and help our patient. It's our duty to help to remove or to try to cover this problem, the tattoo, that he want to regret it and look for a solution. These two facts, remember that we are able to say that a quarter of people around the world have at least one tattoo. This is true. And another truth is a quarter of them, they regret it and looking for a solution, or to cover it or to remove it. That's why it's an all potential patient. Think about that. This is another clue that majority of the lasers that you know act in millisecond or microsecond. That's why they obtain a photothermal effect. Opposite to the quick switch laser, work in nanosecond and picosecond that my colleagues mentioned a few minutes ago, and create a photomechanical effect. And the important thing is that this is a classical endpoint of the quick switches in the upper part of the picture. With the frosting, it means only epidermolysis. That's why we obtain a complete restoration of the skin. It's safe. But in the lower part of the photo, you have the classical endpoint of IPL. You obtain this kind of scabs, and this is going to leave a scar forever. This is my experience since 14 years ago. Total 1,704 patients treated. It's been more than 10,000 treatments around all my experience in tattoo removal. I start with nano, I change to picosecond laser. Why? We use a nanosecond laser. It's good for a treatment, but not good enough because it still have photothermal effects. That's where it's not weird to have side effects and in some cases complications as scars. If you have a picosecond laser, you are quite a complete photomechanical effect. That's why it's really weird to have a scar or complication as a permanent side effects. And this is another reason. More faster, more power, more disruption of this particle of ink. That's why you make it easier the work to the macrophages to eat it and throw it away by the lymphatic system. That's why you obtain more effective result in your tattoo removal treatments. The goal of this lecture is about some facts, tricks, tips, warning, and advice I'm going to give to you. After that, you can ask me anything you want. First, the theory of proof. We talk about the photoacoustic reaction and the way this works. Here is the proof. As you know, we obtain the diffraction of the particles and our macrophages thrown away by the lymphatic system. But this is true? Well, this is true. Look at that. This is difficult and tricky tattoo with a lot of colors. After the first session, start appear a shadow surrounding, okay? Look the white arrows mark that. And after the 10th session, this shadow increase the color and the size. What this means? This is exactly the moment of the microparticles run away with the little vessel of the lymphatic system, okay? This is a proof. I offer my patient the Manu Lacarte. I mentioned that in French. I love to say that. What does it mean? I offer the patient to remove the part of the tooth they hate it and keep the other part they love it. And we can do it that. And this is the example. The patient hates the phrase but love the birds. I keep the birds. Or the other patient, she regrets with the comet and part of the star, but she wants to leave part of the star. And I do it that. Or this constellation, she loves it, but he hates the surrounding tattoo. We can handle that. Or these beautiful flowers is too much. She only want one of them. In the middle, the classical PIH, it went to stay very several months, I show you. And finally, the way we can obtain the solution, the final solution of this tattoo removal. I mentioned the PIH. Usually, you can handle with a prolonged PIH when you try to remove a tattoo. Don't worry about that, handle with that, and you can obtain this kind of result. Because the best before and after photo that I show you in a few minutes take a long time, not less than a year, to resolve this PIH. Just in this case, beautiful photo of the back of my patient, but in the middle, you need to handle with that, okay? Don't worry, handle that. Use, for example, inhibitor of melanocyte or only it's a matter of time and the patient is going to solve it. Another great case, nothing at all, but in the middle, you have that. When at this moment, I stop the treatment and only ask to the patient to be returned for a control and be sure that this PIH disappear month per month. Another case, another one to show you the way I can, this shadow disappear by itself. And Charlie go on, but in the middle, Charlie still appear, and it's only a matter of time to give the possibility to this number disappear forever. Hemosiderosis, as you know, it's not a tattoo, but act like a tattoo. It's this permanent pigment of iron inside the skin, need our help, and only can be successful by the use of laser, pulsed laser, nano or picosecond laser. Another case, my colleague mentioned the scar and the way we can solve it. And in some cases, the tattoo have previously skin texture change by the reaction of foreign body that our body start to act when the ink go inside the skin. And in some cases, I was successful to remove the color of the skin, but not so good enough to have a complete change of these texture changes. Another case, and some texture changes still on the skin of the patients. Another case. Fourth, light colors, the tricky one, the difficult ones, green and light blue. Even I have a specific wavelength for that, like 695, 660, is still a headache. I need more sessions than usual, in some cases 12, 15 sessions, for example, to treat this funny mosquito tattoo. And this is what is happened. This is at the end point, and at the final treatment, I'm not good enough to remove all the tone of the color. Another case with a successful treatment, I was able to remove majority of the tone of the color, not permanent, transitory hyperpigmentation, and the way we solved that, we still have a little point of leukoderma, but majority of the hyperpigmentation go away. Another difficult tattoo with great quantity of green, and the way I can solve it, but look at 12 sessions with picosecond plus 2 sessions previously of nanosecond. A cosmetic tattoo, the first warning you need to tell to your patient is that is made by iron and change, oxidate and change the tone between black to gray to brown or red, and you can handle it, you can solve that, change it the wavelength that you need to use with the picosecond laser, but you need to warn the patient because of course she is scared about this change of tone of colors. And in some cases, the patient surprised us because I made only one session, change to black to brown, as I mentioned to my patient, and decided to stop the treatment because she loved this new tone. Allergic reaction is only for red because it was made by sulfuride and create these exaggerated reactions. In some cases, this reaction leaves a scar. Fortunately for us, not in this case. I was able to erase all the white tone, and this is the patient when re-tattooed again. Another case, River Plate is the name of a famous soccer team in my country. He put the corazón, the heart, before the name, and I was able to remove that, but keep the River Plate name on the skin of the patient. White is a head color because usually the patient doesn't know that they have this color, and when you apply the 24 nanometers of wavelength, you change the tone to gray, and it's difficult to handle with that. I prefer directly not treat the patient with that white color. I give you this advice because in some cases they have a disappointment with you with this change of the tone. Leukoderma and transitory hyperpigmentation. In some cases, this is my result. In some cases, I can handle with, I can solve that. Or this another case. But nowadays, I add the use of CO2 after I remove all the tone of the color to obtain hyperpigmentation. That I look for that to recover part of the tone of the natural skin color. Or this another case, and I change the texture on the skin too. Finally, another case that I don't do nothing. The patient came only once a year to treat it because he lived outside my country. And between the third and the fourth photo is only a matter of time, only take a complete year to restoration part of the normal pigment of the skin. That's why don't be scared. In some cases, it's solved by itself. I asked myself, who are the ones to rate and look for tattoo removal over my population, over my patients? And they gave me the possibility to make a survey over 757 patients and publish in Medical Laser. And that's what I found. Majority are female, 60% of them, with the average of 30 years old and with a high education level. Really far away, if you try to, you will look lecture about tattoo removal 10 or 20 years ago, the population complete changes. Finally, in some cases, it's difficult to find any sign of the tattoo. Fortunately for us, this is true. Like in this case, another case in the arm, forearm, another case without any sign of previous tattoo, another case without any shadow, any sign of tattoo, like this case, and another case, and finally these cases. And close to the end, I asked my patient only to masturate, use sunscreen, and the clue for me is in the case of inhibitor melanization, some case tranexamic acid, kojic acid, hydroquinone, or a combination of them. And some take-home message, best color to remove, black, yellow, and red are easier. Worst color to remove, green and light blue, as I show you. White and cosmetic tattoo are tricky colors. You need to warn the patient about that or avoid them. Amateur tattoo are easy to remove. Many colors, slow result. The more recent, the slower the removal because you have a lot of ink. And the closer the tattoo to the lymph node, the faster to remove it. Finally, conclusions. In my experience, by change of the device to nano to picosecond, I cut my regular average oscillation to 20 to 40%, and it's good enough for me. High peak of power and less unit of time, best result, looking for that. That's why my first advice, look for the most powerful, fastest, and versatile liquid switch available in your area. Ask for that. And the last one, study the population in where you live, because 1 in 4 inhabitants have a tattoo, and 1 in 4 of them look to remove it because he wants to try to cover or try to remove it forever. And they are potential patients. Thank you to listen to me.